Hey, what's up guys? This is Josh from Upright Health, and today we are going to talk about some strategies that you can take to turn on your lateral hip muscles, mainly your glute medius. Now, these muscles are very important for healthy hips and for a functional hip region. Now, a lot of what we do in conventional exercise, what you're doing in the gym, is based in this kind of sagittal plane. Okay, now what that means is that your knees, your hips, your shoulders, everything is flexing and extending in this sagittal plane. But what we are sometimes neglecting is these kind of side-to-side movements, rotation, right? These are kind of movements that you see in sport and activity, but that don't usually make their way into a, like I said, conventional exercise routine. So it's very important that we train these muscles to do their job. Okay, so a lot of the times we have people come in that are having some type of hip dysfunction, maybe lower back dysfunction, and they've been doing some glute work. They've been doing, say, bridges on the ground on your back, pushing your hips up, which is going to target that glute max. But what's getting neglected is this glute medius. Okay, so we're not getting a lot of hip abduction. And like I said, it's very important for the functionality of your hips to work properly. Okay, so we're going to give you a couple exercises here that you can do and make sure that you are activating and using those muscles correctly. So let's get to it. So one of our favorite and main exercises that we use here is the side lying leg lift, and that's going to look like this. I'm going to come down onto my side here. I am going to stack my knees to either like a 60-degree angle or 90. I'm going to extend this top leg, and I'm going to lift this leg up like so, trying to recruit this lateral hip musculature to do the work. Now, this is, like I said, one of our favorite exercises here, but it's also something that can be difficult if you're really tight and maybe you can't get this musculature to kick on and you're using a lot of, the front of the hip musculature, or maybe it's the opposite problem and you're more of a hypermobile person and you can't really stabilize your pelvis very well. So when you're coming up, your pelvis is kind of flying all over the place, and that is not making you use these muscles optimally. So what I like to do with people that are having trouble with this is we get against some type of surface. So we get against a wall here, and now this is going to be a clamshell against the wall. So what I'm going to do is I'm going to get myself to about 90 degrees at the hips, 90 degrees at the knees here, okay? And from here, we're going to put our feet flat on the wall, and we're going to keep, about 5 to 6 inches between our feet, right? You can mess around with that foot position. But now, because we're up against the wall in this 90 position, everything is locked in. My pelvis is locked in, so I don't have to worry about stabilizing that as much. We're going to keep a little bit of tension in the stomach here, just to make sure that everything stays aligned. And from here, all we're going to do is just push this knee up and then back down. Okay, now notice this is a very small movement here. Okay, but what we're doing is we're actually getting true abduction out of our hip here. All right, and after you do about, depending on your level, 6 to 8 of these, you should start to feel that glute medius starting to really turn on and really start to fatigue. Okay, I think I've done close to 8, and I'm already feeling quite a bit of fatigue here. Okay, and now notice that I'm trying to keep this top foot flat. Actually, we don't really want to do this because then we're starting to externally rotate at the hip, and the pelvis is starting to change positions. If I can keep my foot flat and keep that big toe in contact, then really what's going to be doing all the work is that glute medius. Okay. If that's something that you have to work up to and you have to start with your toe a little bit off, that's fine. But let's try to work up to keeping that foot flat and getting this true hip abduction. All right, guys, that is just a simple strategy to turn on that lateral hip musculature if you're having trouble with that, or if you know that you need to add something like this into your exercise routine, because it is very important for proper hip function. So let us know how it goes. Give us some feedback if you found this effective at all for you. If you like the video, please like the video. And remember, pain sucks, life shouldn't.